Hey guys, this is Greg with Medical Muscle. And in this video, I want to go over the differences between the content and basic science years, okay, the year 1 and 2, and clinical years, year 3 and 4, and some of the similarities. So let's talk about it. The similarities, I think there's two major ones. Content difficulty. I think the content stays pretty much about the same difficulty level. I don't think that changes from year 1 all the way to year 5. Now, what is difficult about each year does change, okay? So year 1 and 2, when you're studying for step 1, covers more of the biochemistry and the memorization and all that kind of stuff, the theoretical stuff. That can be quite challenging because you have to memorize things. For step 2, it comes down to more of obviously the clinical skills. What is the best situation, or what is the best answer for this specific situation? So you have to memorize. Step 1, you have to memorize something to get the right answer. Step 2, you have to give an educated guess. The answer is different depending on the situation, okay? It's very unsettling that you're answering a question not being completely sure, because you're having to kind of make an educated guess about what the right thing is, because it's not memorization anymore. Every situation is different. You know, if the patient is now pregnant in this situation, it's going to be slightly different. What you decide to do, it might be the same, but it might not. You have to make that judgment, okay? The treatment for that. A little challenging, but the content itself, what you need to know is pretty much, the same level of difficulty, okay? And number 2, what the similarity is, the hours that you will be studying a day, I think is relatively the same, okay? I don't think it changes that much. I actually think I studied less hours a day than I did in clinicals even, okay? No more than like 2 to 3 hours a day in clinicals, but that was, concentrated studying. That's probably about the same as I did. I did probably a lot of fluff studying in the first 2 years. I wasn't a good studier. It takes time to build that skill, right? So what took me, 5 or 6 hours in year 1, I could probably get done in like, 3 hours, 2 hours now, because I know how to study. And that's a skill you just build. But yeah, the amount of hours that you put in, probably about the same. Now, here comes the obvious differences, and this is why year 3 is significantly harder than years 1 and 2. Significantly. You have other responsibilities, okay? So you have to be at the hospital for 10 hours a day, 12 hours a day, 24-hour shift, okay? You're there for 24 hours. Where are you going to find those 3 to 4 hours of study time? You have requirements. You have things to do. You have patients to go see. You're going to be texted sometimes during a shift. You may be getting texts all day or messages saying, hey, go see this patient. Hey, go see this. Write this note. You sit down for a little bit. You have a little bit of time to study, and then you get another consult or something. That can happen. Okay, so the study environment is not always ideal in clinicals like it is in year 1 and 2, okay? I've heard people say, oh man, I had my family members that were really loud and really distracting in year 1 and 2 if you were studying at home. Well, just imagine clinicals where you're in a hospital and you're having to study in the OR, okay, between patients in a cold OR. You have just a few minutes just to pump out a few Anki questions or something, okay? So it's not ideal. And it really pushes people for good time management, okay? So, while you're at the hospital, when you have downtime, can you pump out what you need to do? Or can you be focused for that amount of time? And then when you get home, you will inevitably be having, have work when you get home. Are you going to be focused to get that work done? And are you going to be able to get to bed on time so that you have the energy to keep doing this for months? Okay, it really requires you to be organized. Year 1 and 2, you can mess around quite a bit, right? You only have to get 6, maybe up to 6 hours of total work, between lectures and pre-reading and all that stuff. Okay, so you have a lot of free time. You have a lot of time to exercise. You have a lot of time to sleep. Year 3, that's just not the case. Okay, Now, another big factor is that between terms 1 and 5 at SGU, the first 2 years, you're given lectures. You're given a schedule. You know what you need to study every day to keep up with the pace of what's going on, which is very helpful. Okay, that's very helpful. You still have to be self-motivated, but at least you know what you need to be studying. Okay. That's not the case in year 3, okay? They have some schedules set up for some people. I didn't use them after a while because I found they weren't efficient for me, and I think a lot of people did. You have to figure out a different study method that works for the situation that you're in, okay? Because you're at very limited time, right? It's not like you can just like study another 5 hours once you get off of a 10-hour shift. No, you don't have that kind of time, okay? So you have to sleep, you have to eat, you have to exercise. So you have to be very efficient and you have to be very self-motivated to get work done without any kind of schedule, okay? Know what you need to work on, okay? Okay, and another big factor going into clinicals, a huge shock to the system, is that now all of a sudden you're given this incredible responsibility. You're a student, but sometimes what you do with the patient will kind of influence their care. You know, people listen to you, especially if you are staying on top of your shit, right? And you're staying educated. Residents and attendings, if you make a suggestion, they'll be like, that's a good one. We should go down that path. But in the back of your mind, you're like, I hope I got the information right, because now we're going to go down this path of treating this patient. And, you know, I hope I'm not steering them away from something else that's more important. So you have this responsibility that you need to be on top of your stuff. I'm going to say that most people, you know, double check your work, okay? But in certain situations, you know, people take your word. They're like, I believe what you said, and we're going to go with that. Okay? So you kind of have, you have a lot of responsibility. You're no longer just this, you get to be just this student. Okay, you're part of the team. You know, obviously you have residents that you can ask questions and make sure there's people looking over your work, attendings that are looking over everybody's work, but you're part of the team now. All right. And I could say the last huge challenge with clinicals is that, and this is just hard. It's just the hard part is the social aspect. Okay, so you're not seeing friends. You're not spending as much time as you would with family. You know, even if, you know, you're on the island in Grenada, you don't have a lot of time with family, but you have a lot of time to hang out with friends. You have a lot of time to goof off and decompress. That's just not possible. Everybody's on different rotations. Even the people that I'm in the same hospital, if we're all on different rotations, someone's in psych, they have a lot more time off, but someone's in surgery or emergency medicine, our time schedules are all going to be chopped up. You don't really get to spend the same time with your classmates as you did before. It's kind of a bummer. I think it kind of isolates you, right? Because it forces you in a situation where you go to the hospital, you get your work done, and you just get home and just study. Very isolating. It's very difficult emotionally. And I think year 3 is really meant to weed people out who not only have a good base of clinical knowledge, or, you know, the basic science knowledge, obviously, the clinical knowledge, the work ethic, the organization to be able to handle all this, and the professionalism to be able to talk to patients and get good information from them and discuss that information with the attending in an intelligent way. All right. Now, I do have to say there's a light at the end of the tunnel. Year 3 is the hardest year, but you make it through year 3 and you get to year 4, you're coasting, baby. You know, after step 2, there's really nothing much I am required to do, right? You have to take the OET, which is the English exam. That's a cakewalk. I don't think you really have to even study for that. I mean, it's good to just look over what you need to, maybe in a day. Not that hard. And family medicine. I haven't taken family medicine yet, so I have to pass that. But for the most part, that's it. You have to just show up to the rotations, you know, be present, write notes, but there's no more studying, which is crazy to think. I mean, you got to study specific stuff. It's like it's like personal study. It's where you're just like going on research papers and like looking at interesting facts that you can present that just sound interesting, but you're not doing any like lectures anymore. It's such a trip. You have all your weekends and to go to a weekend and like not have to worry about doing anything is so crazy. It's nuts. I mean, obviously I got to worry about interviews and all that stuff. That's important. But man, it's fantastic. So that's the other benefit, is that half of the clinical years is the easiest year of medical school. Medical school is really only 3 years. Feels like the 4th year is just coasting. Okay, but it takes a lot of work to get to this point. So I hope you guys kick butt on any exam that you're working on, and I wish you the best of luck.